There's no question that healthcare costs are at the top of the minds for many Americans, myself included. And the cost of prescription drugs are a concern for workers and families. Sadly, instead of working on bipartisan solutions we all agree on, the bill we're discussing today seeks to impose radical price-setting policies that run the risk of decimating biopharmaceutical research and jobs. In Michigan, a state that is proudly producing the COVID-19 vaccine, 86,000 jobs are supported by the biopharmaceutical sector. Moreover, the bill will reduce necessary investment in research and development and access to breakthrough cures for difficult and rare diseases like Alzheimer's, childhood cancers, sickle cell anemia, to just name a few. We all have met families or know someone who have felt the devastation when a loved one has been diagnosed with a disease with no cure. So it's disappointing that we are here again, holding a hearing on this socialized agenda drug pricing scheme that would further dash the hopes of finding breakthrough cures, and I believe saving many, many lives. But we ought to talk about it. So here we are. And Dr. Holtz-Eakin, thank you for being here with the rest of your panel. You note in your testimony that it takes on average $2.9 billion and 15 years to bring a successful drug to market, and many drugs are never approved. How would putting the HHS secretary and Washington bureaucrats in charge of price setting add political risk to the already risky process of developing and delivering drug treatments to Americans?
It would add an enormous amount of risk. You'd be exposed to the starting point, which is the average indexed market price, international market price. That's something you don't know and was in the control of bureaucrats outside the United States. You would then have the secretary having the unilateral power to declare whether negotiations were in good faith or not, run the risk of getting the drug essentially taxed out of the domestic market entirely and having no revenue. Those are just recipes for increased risk and less capital flowing to that industry. I mean, everyone always thinks the drug companies somehow are going to get in the fetal position and stop developing drugs. No, that's what they do, but then no one will give them the money, and that'll be the reality.
And that just makes common sense, which maybe is not all that common. Dr. Holtz-Eakin, we know that China is striving for a bigger footprint in biotechnology, as to be assumed. I'm concerned that the policies put forward in H.R. 3 would make the United States more reliant on other countries like China for research and development. Can you speak to what repercussions greater reliance on China for our medical breakthroughs would have on the United States?
I think there are two big concerns. Number one has been the well-noted issue of security of supply chains for those drugs that are already in production. And it is a sensible question to ask whether you want something in China or not. And if not, make sure that you have something that will survive some sort of stress test as a supply chain outside of China or in the US. And the second is, where will you go for innovative and important therapies that are not produced in the United States, but which our citizens would like to have? And that's a situation that I think people are increasingly find to be problematic as the Chinese continue to not play by international rules, trade on level terms with others, and thus violate their international obligations.
We've certainly seen that over the course of the last year, haven't we? Dr. Holtz-Eakin, you note in your testimony that the sweeping nature of the proposed reforms in H.R. 3 do not just apply to Medicare, but would also apply to plans operating under ERISA. If H.R. 3 becomes law, how would employer-sponsored health plans be impacted?
They end up in the same pricing regime. I don't see any way around it. I mean, the starting point's the average international market price. That becomes the maximum, and then an ERISA employer could try to negotiate and get a lower price, but they've got their employees in their formula. The secretary has a 95%. I will levy this and you're out of business club in their hand. There's no question the secretary is going to cut a better deal. This is not a negotiation. This is using the fiat power of the government to set prices.
I appreciate the response. Thank you.